Hello guys, how are you all? Very good evening to all of you. So hope all of you are doing great. Hi Rowdy, Osama Sheikh, good evening. So guys, so today we shall be discussing two important topics, okay? One is by name neonatal respiratory distress syndrome, okay? And after that we shall be discussing cerebral palsy. So we shall discuss all the possible etiologies, the pathophysiology, the treatment procedure and the diagnostics and everything, okay? So what we shall do is that first I'll be keeping on discussing the topic, है ना? एक बार once topic gets completed, then we'll have some time like 5 or 10 minutes. In that time we can discuss the things which you didn't understand or if you have any doubts and all, so that we can fastly finish up the topics. Okay? Right. So if you are all fine now, if you give a green signal, then I'll start. Yeah. Very good. Chalo. Good evening, HN Creation. Shraddha, good evening. Good evening, Dr. H. Chalo. So first of all, what is this neonatal respiratory? All of you know what is respiratory distress syndrome. So there is some distress, there is some extra effort while respiration, right? Now, that is happening in which age group? That is happening in neonates. So first of all, we shall look out what are the other names for this neonatal respiratory distress syndrome, and then we shall enter into the etiologist. Okay. So this neonatal respiratory distress syndrome is also called as infant respiratory distress syndrome. Okay. Infant respiratory distress syndrome. Respiratory distress syndrome. You know, from now onwards, what I'll do is that I'll just write it as RDS. RDS matlab respiratory distress syndrome. Okay. Now, why this neonatal respiratory distress syndrome is happening? We will, yes, don't worry. We will discuss everything point to point by concept. Okay. Why in infants there is respiratory distress syndrome is the main reason of this topic is surfactant deficiency. The entire topic is completely circling around this one word, surfactant deficiency. So that is why it is also called as surfactant deficiency respiratory syndrome. Surfactant deficiency disorder. Surfactant deficiency disorder. Okay? This is also called as surfactant deficiency disorder. Next important thing is that this is also given another name called as hyaline membrane disease. अभी इसको hyaline membrane disease क्यों बोलते हैं? I will tell you when I will be teaching pathophysiology. ठीक है? So it is also called as hyaline membrane disease. Hyaline membrane disease. Okay? Now, this neonatal respiratory distress syndrome, if you basically look guys, most commonly you see this at an age group. I mean, you see in a preterm or a premature infant. Okay? So if a mother is giving birth to a premature infant or a preterm infant, so in those group of individuals, those group of children, you will basically see this kind of disorder. Okay? So if we start from the basics, normally all of you know that a baby is born somewhere between 37 to 42 weeks. You know? Baby is somewhere born between 37 to 42 weeks. Now, if we little bit decode this, 37, 38, 39, 40, 41 and 42. Okay? Now, if the baby is born between 39 to 40 weeks, है ना, इसको बोलते हैं full term pregnancy. Okay? Or this is also called as full term infant. Okay? So, actually you call it as full term infant. This is called as full term infant. ठीक है? अभी 39 से पहले मतलब from 37 to 38 weeks है ना? This is called as early because it came early. So this is called as early term. This is called as early term. So early का opposite क्या होगा? Late. If the baby is born after 40 weeks or before 42 weeks, this is called as late term. This is called as late term infant. ठीक है? Whatever it is, 37 से लेकर 41 तक, this is all the term part, है ना? 37 से पहले, this is called as preterm. After 41, this is called as postterm. So, if a baby is born before 37 weeks of gestation, okay? If a baby is born before 37 weeks of gestation, you call this baby as a preterm baby. Okay? This is called as a preterm infant. So, preterm infant. Usually in this age group itself, right, these babies, these preterm babies are at a higher risk of developing this neonatal respiratory distress. अभी 42 के बाद क्या होगा? What is everything after 42? That is called as post term. That is called as post term baby or a post term infant. Post term infant. Okay, so now you understood the basic thing. The basic thing is, if any baby is born before 37 weeks, that is called as a preterm infant. ठीक है, ठीक है, 37 weeks के पहले, right? 37 weeks के पहले मतलब what is the exact age group? The exact time period is between 20 to 36 weeks. ठीक है, between 20 to 36 weeks, if a baby is born, right? This is called as a preterm infant. You're clear with that? So this is the first very important thing I want you to know. So whenever I'm telling neonatal respiratory distress syndrome, second word should come into your mind is surfactant deficiency. Third word you should come into your mind is preterm infant. Preterm मतलब 20 से लेकर 36 weeks के अंदर डिलीवरी हुआ तो that infant is called as preterm infant. So he is having a higher risk of developing neonatal respiratory distress syndrome. Now what we shall do is that we shall look at the etiologies. ठीक है, एक के बाद एक. So what we shall do is, instead of writing the etiologies fastly here, etiologies, right, what we shall do is we shall discuss each and every etiology in detail. Okay, so first etiology which comes, which I already discussed, ये होगा preterm infant or premature birth. Preterm infant or premature birth. Okay, so preterm infant or premature birth. Now you might get a doubt that I hope all of you know this thing, that why in premature infants between 20 to 36 weeks agar delivery hua, why in these infants there is respiratory distress? The reason is, during this time, right, during this time of about 20 to 36 weeks, kya hoga? During this time the surfactant is not properly synthesized. Okay, so all of you know this basic concept that, for example, if this is an alveoli, okay, alveoli के अंदर क्या होगा? We have got alveolar cells. You see, all these are alveolar cells, or also called as pneumocytes. है ना? All of you know that these are called as pneumocytes. Now, out of all these pneumocytes, there are some special type of pneumocytes. है ना? ये देखो, ये orange में मैं जो draw कर रहा हूँ ना, these are special type of pneumocytes called as type 2 pneumocytes. What are they called? These are called as, very good, type 2 pneumocytes. Okay, type 2 pneumocytes. What is the function of this type 2 pneumocytes? These type 2 pneumocytes, they synthesize or they release surfactant. They release surfactant. ये देखो, this is how the surfactant is released. Okay, this is how the surfactant is released. Now, exactly speaking, at which week surfactant release will start? Surfactant release will start at 20 weeks of gestation. Okay, from 20 weeks all the way till 35 weeks, what will happen is that surfactant keeps on releasing, और जो भी surfactant release होगा, that will spread along the entire alveoli. So मतलब lungs are completely mature or fully formed with surfactant by which age, guys? 35 weeks. So 35 weeks के बाद अगर delivery हुआ, then the risk of neonatal respiratory distress syndrome will be less. Yes or no? The risk of neonate developing respiratory distress will be less, right? Why do we need surfactant? ये है क्या? First of all, what is surfactant? See, basically, if this is your alveoli, okay, lining the alveoli, you basically have surfactant. अगर surfactant नहीं है, then what will happen is that the surface tension here will be increased, and this increased surface tension will pull the alveoli together, and the alveoli will collapse like this. Okay, this collapse of alveoli is what is called as atelectasis. ठीक है, अगर alveoli collapse नहीं होना, then what we should do? We should reduce the surface tension. Surface tension को reduce करने के लिए what we do is we apply surfactant here. Clear? Right. So during this time, if the delivery happens, the time when the surfactant is released or it is completely spreading all over the alveoli, then it would lead to respiratory distress syndrome. Okay. So there is one the research, guys, New England Journal. So in that, what they told is, respiratory distress syndrome is inversely proportional to gestational age. Gestational age. Obviously, अगर gestational age कम है, 20 weeks, right? Then the risk of respiratory distress will be more. If gestational age is more, मतलब 38, 39 weeks, then the risk of respiratory distress syndrome will be less, obviously, right? So this is the base point which I want all of you to remember. So the first important thing, प्रीमेच्योर और प्रीटर्म इन्फेंट, ठीक है, ये पहला इटियोलॉजी है। अभी दूसरा इटियोलॉजी देखेंगे, व्हाट इज द सेकंड वन? सेकंड इंपॉर्टेंट थिंग इज मेटरनल डायबिटीज, maternal diabetes, maternal diabetes. Now before I discuss maternal diabetes, one very important thing I want to tell you is that surfactant, right, surfactant is mainly having three important components. क्या है वो? एक है PG, one is called PC, one is called PI. All of you know PGI Chandigarh, right? So remember it as PGI Chandigarh, right? So one is PG, another one is called as PI, another one is called as PC. Okay, so what is this PG? PG is also called as phosphatidyl glycerol, phosphatidyl glycerol. Okay, and what is this PI called as? Phosphatidyl inositol. Okay, PI is also called as phosphatidyl inositol. And obviously PC is called as phosphatidyl choline. All of you know this thing, I think, phosphatidyl choline. Okay, so these are the three important components of surfactant. Now out of these three important components, ये phosphatidyl choline जो है ना, the other name for this phosphatidyl choline, the other name for this is lecithin. Okay, the other name for this is lecithin. So I hope guys, you please keep on commenting down. I hope you're understanding time to time whatever I'm teaching here. So these are the three important components of surfactant. Now why in maternal diabetes there is respiratory distress? The reason is, ये देखो, for example, mother is diabetic, a pregnant woman is diabetic. So in her blood the glucose levels are high. Listen carefully, the glucose levels are high. So these increased glucose levels through the placenta, right, through the placental vessels, this increased glucose will be transferred to the fetus also. मतलब fetus के अंदर भी glucose levels बढ़ेगा, right? Now whenever there is increased levels of glucose in the fetus, fetus के अंदर pancreas is normal. Pancreas keeps on releasing excess amount of insulin. Obviously all of you know, when glucose is there, insulin will be released. So right now within the fetus glucose levels are high, right? So because of that the insulin levels are also increased. This insulin, this increased insulin will inhibit PC, PI and PG. It will inhibit this phosphatidyl glycerol, phosphatidyl inositol and phosphatidyl choline. अगर ये inhibit किया, will surfactant be formed? Surfactant is not formed. And again surfactant deficiency leading to respiratory distress syndrome, right? So I hope all of you understood. Pilot Saini, very good. Lecithin sphingomyelin ratio, I will tell you at the end in the diagnosis, but you are right, very good. So this is the point which you have to remember side in the box. So what I was telling is, if the maternal glucose levels are high, right, automatically this will affect on the fetus also. So obviously the fetal glucose, the blood glucose levels also will be high. So whenever there is increased fetal blood glucose levels, what will happen? There is increased release of insulin. And what is this insulin gonna do? This insulin will inhibit all these three important things. Okay. So Sajda, good evening Sajda. So all of you understood? So this is all you need to know regarding the maternal diabetes. Okay. Now after this, the third important etiology we will discuss is hereditary. Hereditarily also there is deficiency of surfactant कैसे? Okay. So hereditary. So what is hereditary factors? Hereditary factors मतलब ये देखो, surfactant के अंदर not only phospholipids, there are also proteins. ठीक है? I will tell you two proteins. One is called as surfactant protein number B. Okay? Surfactant protein C. ये दो proteins है. What are these two? Surfactant protein B, surfactant protein C. So even we need proteins also, right? Not only phospholipids. अगर ये proteins mutate हो गया, right? If there is a mutation of these proteins, what will happen? Do you think surfactant will be formed properly? No. So that is what is called as a hereditary factor. Okay. So hereditary factor is if there is mutation. Mutation of which proteins? Mutation of SPB and SPC. Okay. So abhi tak right now we have discussed three important things. Okay. So one we discussed is premature infant or preterm infant. और दूसरा क्या discuss किया? We discussed maternal diabetes और तीसरा we discussed hereditary. Okay. Now, fourth very important thing is C-section or cesarean delivery. So even cesarean deliveries are normally happening. Basically, cesarean, mostly in the private hospitals, cesarean deliveries only happen. Right? In the government hospitals, mostly the normal deliveries happen until and unless there is some kind of emergency or complication, they do cesarean. Okay. So why in cesarean delivery the baby will be born will have a risk of respiratory distress? Yes, cesarean delivery. Right. Before I explain the cesarean delivery, one point you should know that steroids, मतलब glucocorticoids जो है ना, glucocorticoids are responsible for the maturation of surfactant or glucocorticoids are responsible for the surfactant synthesis. ठीक है? So what I'm telling is glucocorticoids जो है, they are responsible for the synthesis of surfactant. Glucocorticoids are responsible for the synthesis of surfactant. Now, in cesarean normal delivery में क्या होगा पहले? In normal delivery, there are uterine contractions, right? There are uterine contractions. Now, when there are uterine contractions, the baby is under a heavy stress, right? The baby is under a heavy stress. Now, within this baby, there is a stress hormone that is released. Stress hormone क्या है? That is cortisol. Yes or no? Now, this cortisol will cause what? Synthesis of surfactant. अगर सीजेरियन सेक्शन हुआ, सी सेक्शन हुआ, डू यू थिंक इन सी सेक्शन द बेबी इज अंडर ए सिवियर स्ट्रेस? नो, यू आर जस्ट कटिंग डाउन द लोअर एब्डोमिनल कैविटी and then removing the baby out, right? So there is no proper stress. So when there is no sufficient stress, obviously within the baby also the stress hormone called as cortisol is not released. अगर cortisol release नहीं हुआ तो the lungs, the surfactant whatever is there, they're properly not matured or not properly synthesized. So this can be also one more reason to add up to our topic. Okay, so let us write down whatever we have told. Okay, so in cesarean section what is happening is that there is no stress. There is no stress. No stress matlab kya? There are no uterine contractions. There are no uterine contractions. So whenever there are no uterine contractions, then whenever there is no stress, obviously no stress hormone is released. No stress hormone is released. So when the stress hormone is not released, what is going to happen? No synthesis of surfactant. No synthesis of surfactant. Osama Sheikh already is telling that is why we give dexamethasone. Obviously, glucocorticoids are responsible for the synthesis. जब glucocorticoids नहीं है, we give an injection of glucocorticoids so that the lungs become mature. Very good, Osama. Right. So fourth के बाद fifth important finding. What is the fifth important etiology is there is a condition. ठीक है? Tell me first of all what are the serous cavities which you have, guys? We have got a pleural cavity. We have got a peritoneal cavity. We have got a pericardial cavity. ये सारे serous cavities है ना? अगर ये serous cavities के अंदर within the serous cavities if there is excess amount of fluid, right? This condition is called as hydrops fetalis. Okay, so hydrops fetalis also plays a very important role. So in hydrops fetalis what is happening? There is fluid accumulation. Okay, there is fluid accumulation in the serous cavities. Fluid accumulation in the serous cavities. Serous cavities matlab in the lungs the fluid will be accumulated and this would lead to what? Pleural effusion. Pleural effusion. So same effusion in the heart, what is it called as? Pericardial effusion. Pericardial effusion. And third important thing, if there is excess amount of fluid in the peritoneal cavity, that would lead to what? Ascites. That would lead to what? Ascites, right? So the fifth important cause is, we shall revise all these things at the end, just listen to whatever I'm telling. The fifth important cause is hydrops fetalis. Okay, now after this the sixth important thing is multifetal pregnancies. Multifetal pregnancies. अभी ये multifetal pregnancies क्या होगा? Multifetal pregnancies मतलब a pregnancy with multiple fetus, more than one fetus is called as multifetal pregnancy. Okay, so obviously you can relate, if within the pregnancy if there are more fetus within the uterus, more than one, there can be a chances of respiratory distress, right? So multi-fetal pregnancy matlab if the pregnancy with more than one fetus. Okay, so what will happen is that such pregnancy, right, such pregnant woman has a higher risk of giving birth to a premature infant. Okay, so the risk of preterm infant is more. The risk of preterm infant or premature infant is more. Okay, and the final important cause which we will discuss now is the male sex. Obviously, basic thing you have to know, compared to male lungs and the female lungs, male lungs, they mature lately. Okay, there is a delay in maturation of male lungs in comparison with the female lungs. So that is why this respiratory distress is most commonly seen in the male. Okay, so you just have to know that male has a delayed lung maturation than females. Delayed lung maturation than females. Okay, so these are the 7 factors, guys. Okay, kya hai wo 7 factors? First we discuss is preterm infant or a premature birth. Okay, second is maternal diabetes, insulin will inhibit all the 3 important things. Okay, uske baad aayega hereditary, and after that we discussed about cesarean, then we have discussed about hydrops fetalis, then we have discussed about multi-fetal pregnancies, and finally the male sex. So these are the 7 important risk factors for respiratory distress syndrome. Now exactly इस respiratory distress syndrome में क्या हो रहा है? What is the pathophysiology? Okay, so before I discuss pathophysiology, what first thing you have to know is that you just have to look at the picture which I'm drawing. So all of you comment down, did you understand all the etiology still here, whatever I've explained you? Yeah, before I draw the picture, you just keep on telling me. So this alveoli, whatever I'm drawing, ये जो है ना, this is called as a normal alveoli. Okay, अभी collapsed alveoli क्या होगा? This is collapsed alveoli. ये देखो, alveoli is collapsed. Okay, why? Because I told you normal alveoli is having surfactant, collapsed alveoli is not having surfactant. Okay, now all of you look here. I am drawing one collapsed alveoli यहाँ पे. So this is one collapsed alveoli. Actually, this picture is showing that the alveoli is not collapsed, but to make you to understand this concept, I have just inflated the alveoli. Okay, but it is a collapsed alveoli. Let us also draw the heart over here. Now, all of you know, from your right ventricle, here you have got pulmonary artery. Now, this pulmonary artery goes all the way like this, right? And here you have got your pulmonary capillaries. Okay, and finally, these are the pulmonary veins which are draining into your left atrium. Now, based upon this, we shall discuss. First important thing, agar alveoli collapse over, do you think oxygen can enter into the alveoli? First point, no. So, oxygen cannot enter into the alveoli. Okay, so we have got a collapsed alveoli. In this collapsed alveoli, oxygen is not entering, and not only that, all of you should know that we have got carbon dioxide here within the pulmonary capillaries. Can carbon dioxide enter into the alveoli? No. Collapse हो गया, कहाँ से enter होगा? No. So oxygen and carbon dioxide diffusion is not at all taking place. So oxygen carbon dioxide diffusion is not at all taking place. Okay, now when oxygen and carbon dioxide diffusion is not at all taking place within the pulmonary capillaries, if I ask you what is the status, what will you tell? Level of oxygen बताओ pulmonary capillaries में कम है कि ज्यादा है? Oxygen is not coming inside, so obviously the level of oxygen within the pulmonary capillaries is low, level of carbon dioxide within the pulmonary capillaries is high, right? अब ये देखो, if oxygen level is low within the pulmonary capillaries, you call this condition as hypoxemia. Okay, and if carbon dioxide level is high within the pulmonary capillaries, you call this as hypercapnia. Hypercapnia. Okay, so what will happen when there is hypoxemia and hypercapnia? Specifically speaking, whenever there is hypoxemia, है ना, वहां पे blood vessels जो है ना, they undergo vasoconstriction. Okay, they undergo vasoconstriction क्योंकि यहाँ पे ऑक्सीजन सप्लाई करके कोई फायदा नहीं है. There is no need of supplying blood here because the alveoli is collapsed, it is not at all receiving. So इससे अच्छा I will vasoconstrict and supply the remaining amount of blood to the alveoli which is healthy, right? So what is going to happen is that these alveoli, they undergo vasoconstriction यहाँ पे. You see the alveoli are undergoing vasoconstriction here. Right? So whenever there is vasoconstriction here, all of you look now, see this is a vasoconstriction. Here also there is a vasoconstriction. So this vasoconstriction is happening why? Because of hypoxemia. This is called as hypoxic vasoconstriction. So this phenomena is called as hypoxic vasoconstriction. Hypoxic vasoconstriction. Okay. Now, because of this hypoxic vasoconstriction, I hope all of you are with me, all of you are understanding whatever I'm teaching. Hai na? So, because of this hypoxic vasoconstriction, what is happening? What is happening is that ये alveoli, ये pulmonary capillaries है ना, within this pulmonary capillaries, the level of carbon dioxide is keeping on increasing. When the level of carbon dioxide will increase, this would lead to a condition called respiratory alkalosis or respiratory acidosis. Obviously, it would lead to a condition called as respiratory acidosis. Respiratory acidosis. This is the first important thing. Okay. Second important thing, because of this hypoxic vasoconstriction, or because of this hypoxemia or hypercapnia, what is happening is that ये alveocytes है ना, pneumocytes, right? The permeability of these pneumocytes is increased. मतलब there are gaps in between the pneumocytes. When there are gaps in between the pneumocytes, the fluid which is located outside the alveoli, है ना, interstitial fluid जो है ना, this fluid starts entering within the alveoli. They start entering into the alveoli. What is the consistency of this fluid? This fluid is a protein-rich fluid. So there is a protein-rich fluid that is entering into the alveoli. ये देखो, there are also proteins in between. Okay, so this kind of exudate, whatever is there within the alveoli right now, is called as fibrinous exudate, because they are having a rich amount of proteins. Okay, so second important thing, what is going to happen is fibrinous exudate. Fibrinous exudate. After some time क्या होगा? There are a lot of fibrous materials है ना, fibrous exudate है ना within the alveoli. These fibers, these proteins, they become hard and glassy appearance. Okay, hazy or glassy appearance. They become hard and they turn into a glass or a hazy appearance. So that is what is called as a hyaline membrane. इसीलिए इसको hyaline membrane disease बोलते हैं. Okay, that is why you called as hyaline membrane disease. So after some time, in the long run, what is going to happen is that the proteins, whatever is there within this exudate, they become hard and glassy. Hard and glassy. So this hard and glassy layer formation जो भी है ना, this is called as hyaline membrane. That is why you call it as hyaline membrane disease. Okay. So I hope guys, pathophysiology you understood. Only 3 points you need to remember. First point is hypoxemia, hypercapnia. Because of that, the second point you have got is hypoxic vasoconstriction. Third point which you have got is respiratory acidosis, and fourth important point which you have got is fibrinous exudate. So these are the 4 important points which you have to remember. Okay, very good. Now what we shall do? What we shall do is that we shall look at the clinical features. Okay, we shall look at the clinical features. Now in these clinical features, what do you know? The lungs are completely, right? The fetal lungs, if you look, the fetal lungs are completely filled with the fluid. Now do you think the fetus, can he breathe properly? Sorry, the baby, can the infant, can he breathe properly? No, right? So this is called as tachypnea. Okay, along with tachypnea, what is happening? He is trying to take the air inside by contracting all his muscles, intercostal muscles. So you can very clearly see on the chest of an infant, there are intercostal retractions. Okay, intercostal retractions. So from today onwards, guys, whenever you see these 2 important signs like tachypnea and intercostal retractions, you should think that right now the patient is having an increased respiratory effort. Okay, he is under an increased respiratory effort. So first important symptom, first important clinical feature we have is tachypnea, intercostal retractions, which means increased respiratory effort. Second important one is that when the lungs are collapsed, sufficient amount of oxygen is not reaching to the pulmonary capillaries. So obviously this will end up having cyanosis. Cyanosis matlab baby's body will turn to blue color, है ना? That is why you call it as blue cyanosis. Cyanosis, है ना? Previously guys, I told you there are two types of cyanosis, right? Or two types of asphyxia, blue asphyxia, white asphyxia. Okay, if the oxygen levels initially are disrupted, this would lead to blue asphyxia. Baby will turn to blue. If the hypoxia is still continuing for a longer time, from blue the baby color will change to pale. Okay, that is called as pale asphyxia or white asphyxia. Okay, so these things we have discussed in the previous classes, right? Third important clinical feature. Third important clinical feature क्या होगा? Third important clinical feature is there is expiratory grunting. Expiratory grunting. Now this is something that is very important to know, guys. Why there is expiratory grunting is that this is our body's auto backup mechanism, you can say. Okay, so what is this expiratory grunting is? For example, these are the lungs. Okay, so this is one alveoli which is normal. अभी एक alveoli जो है collapsed है. Okay, just for picture sake, for explanation sake, what I'm drawing is I'm drawing this as a glottis. So this is your glottis. Okay, ये देखो glottis का एक छोटा सा opening है. Now right now guys, our main intention is we whatever ये alveoli जो deflate हुआ ना, we have to inflate the alveoli. If I have to inflate the alveoli, I should put in more pressure of air. I should put in more positive pressure, है ना? So what I do is that whenever I take air inside, what is happening? The alveoli are expanding. At the same time, this glottis, whatever is there, this glottis or glottal opening, whatever is there, even the glottal opening is also opening. So what is happening? Excess amount of air is entering within my lungs. अभी ये air क्या करेगा? This will try to inflate the lungs. Now when I am expiring the air, you might think all this air might go out. But in this condition, what will happen is that most 80% of the air remains within the lungs, only 20% is escaping out. कैसे? The reason is, what our body does is that our body will close this glottic opening. Okay, so leaving a small narrow foramen. You can see a small narrow opening. Through this narrow opening, what will happen? Some amount of air will escape out, but 80% of air will remain in the lungs. So whenever the baby is taking the air inside, every time extra amount of air is getting added up. ये extra amount of air क्या करेगा? It will try to inflate the alveoli back to normal position. Okay, so when the baby is exhaling the air outside through this very narrow opening, there will be a sound that will be heard, and that is what is called as grunting. That is, we call it as expiratory grunting, grunting during expiration. Okay, so this is one very important thing which you have to know. Now, after these clinical features are done, first what is the important thing we do? First important thing what we do is that the diagnosis is X-ray. Okay, once if you look at an X-ray here, all of you look at an X-ray and tell me that can you very clearly find respiratory distress here, guys? Yes or no? Batao. So we take an X-ray. All of you just comment yes or no. You can find a respiratory distress here very clearly. Kaha yes. Right. Basically, I don't find any respiratory distress because this is a normal X-ray. Okay? ये normal X-ray है. This is a normal X-ray. Okay. Now compare this X-ray with this one. Now look at the difference between the first X-ray here and the second X-ray here. Right? If you look at the X-ray clearly, very good, very good. If you look at an X-ray clearly, you can see all that white color haziness in the lungs. Right? So this is nothing but called as pulmonary edema. Why pulmonary edema? I have told you in the pathophysiology. Okay? Or some kind of dots like disturbances, whatever you can see. If I wanted to tell you in a lame language, right? Dot like disturbances, whatever you can see. This is called as ground glass opacity. Ground glass opacities or ground glass densities. Ground glass opacities or ground glass densities. I'll show you a next X-ray also. ये देखो, yeah, very good. Osama Sheikh is telling whiteout X-ray. Very good. It is a whiteout X-ray only. ये देखो. Now look at this. in this X-ray, can you see some kind of disturbance, haziness, or there are some dots and dots, a lot of dots that are present within the X-ray, to speak in a simple language, yes or no? So this is what is called as your ground glass densities basically. Okay, so you see, you cannot see a proper lung here. Why? Because there is a lot of fluid buildup in the lung, which is interstitial pulmonary edema. But I want you to concentrate on one very important thing. If you look in the X-ray, can you see a black color line here, guys? If it is not clear, I'll show it to you in the next X-ray. ये देखो यहाँ पे, right here, can you see this black color line which is branching into two? ये देखो, here also can you see this black color line? पता क्या है? This is called as air bronchogram. Okay, so what is this called as? Air bronchogram. So this sign is called as air bronchogram sign. Okay, why this air bronchogram? This tells that the lung is under severe respiratory distress. Okay, so in case of severe respiratory distress, you would see this air bronchogram. Right? Yeah, Saini, very good. You're perfectly right. There is also a Ryle's tube that is inserted. This tube, whatever is there, ye dekho, thin white color line which is in the stomach, right? So this is the NG tube, nasogastric tube, or a Ryle's tube. Ye dekho, ye Ryle's tube. Very good. Very good finding, Saini. Very good. Okay, right. So first important diagnosis क्या करूंगा? What is the first important diagnosis I do? X-ray. X-ray में what will I see? Ground glass opacities, air bronchogram sign, and pulmonary edema. Okay, on both the lungs, not only on one lung, on both the lungs you see. Okay, now let us look at the second diagnostic feature. Second diagnostic feature, पहला हो गया X-ray. Second diagnostic feature is blood gas analysis. अभी आप लोग बताओ, ब्लड गैस एनालिसिस मतलब विल यू सी रेस्पिरेटरी अल्कलोसिस और रेस्पिरेटरी एसिडोसिस? रेस्पिरेटरी एसिडोसिस, राइट? यू वुड सी रेस्पिरेटरी एसिडोसिस. Respiratory acidosis, right? So Deepu Niranjan, I hope you are understanding whatever I'm telling you. Third important thing. What is the third important thing is that, sir, only after delivery we'll get to know that the baby is under respiratory distress, or before the delivery? I mean, prenatally also can we get to know? Yes. How do you know prenatally that the baby is having a risk of respiratory distress syndrome? By taking a little bit of amniotic fluid and doing some tests. Okay, so that is called as amniocentesis. I will tell you what is that. Amniocentesis. You do amniocentesis for what? For prenatal testing of neonatal respiratory distress syndrome. Okay? What is this amniocentesis? What is this amniocentesis? In this amniocentesis, the first important thing you need to know is that within the surfactant, we have got two important things. I told you that phosphatidylcholine, you remember, other name for phosphatidylcholine is lecithin, है ना? So within the surfactant, we have got lecithin, and within the surfactant, we have got another lipid called as sphingomyelin, है ना? ये दो चीजें हैं. If these two are more, it means surfactant is more, it means lungs are mature. If these two are less, it means surfactant is less, surfactant is not formed, and lungs are immature. Right? So what I do is that I do a ratio, lecithin sphingomyelin ratio. Lecithin sphingomyelin ratio. Okay? So normally in you and me, the lecithin sphingomyelin ratio, right, it should be more than 2. This will indicate mature lungs. Right? This will indicate mature lungs. Right? For example, if the sphingomyelin ratio is less than 1.5, then this indicates immature lungs. Immature lungs. Clear? Right. After this, the second important thing which you will see here is that, see, one very important thing, what I do is I do a little bit experiment. Okay? There is a small experiment which you do. Now, what is this experiment is that, for example, I have taken this bottle. I hope all of you can look at this bottle, guys. Yes? अब ये देखो, within this bottle, this white color thing, whatever is there, this is called as surfactant. है ना? ये surfactant है. Now what I have done, I have taken surfactant, I have added surfactant here. इस surfactant के अंदर I have also added ethanol. अब ये देखो, surfactant will produce foam, that is why surfactant is called as foaming agent. Ethanol जो है that is a non-foaming agent or anti-foaming agent that will reduce the foam. ठीक है, अभी एक foaming agent called surfactant, एक anti-foaming agent called as ethanol, both of them I have mixed in this. Mix करने के बाद मैं क्या करूंगा, I will shake this. Okay, now when I shake this like this, all of you can see a foam is formed, right? Now I will put this bottle aside. Now what I will do is that I will look at this bottle. Now I'll calculate the time, how much time it is taking for this foam from this point to get down till this point. I will calculate that time and I'll make an analysis. So this experiment, whatever I have done, in this experiment, agar surfactant zyada hai, then the foam will be more. It will take a lot of time for the foam to get down. If surfactant is less, right, the foam will be less, and also it will take a fast time, right, or a very less time for this foam to get down. I hope you understood, right? So this experiment, whatever I have done, this is called as foam stability index. Foam kitna stable hai, right? Foam stability index. Foam stability index. Okay? Foam stability index, always it should be high. Agar foam stability index is less than 0.48, then it is suggestive of what? It is suggestive of respiratory distress syndrome, right? And final important thing is I do a ratio between the surfactant and albumin. Low surfactant. So in this patient, I will find low surfactant albumin ratio. Low surfactant albumin ratio will be seen in this patient. So this is all the diagnosis, guys. You will start with the X-ray, uske baad blood gas analysis, uske baad amniocentesis you will do before the delivery itself. Okay, if you are thinking that the baby is gonna be, we are going to deliver a premature baby right now, then you better do amniocentesis, right? And by doing this, you can get to know the risk of the respiratory distress. Okay, right? What is a treatment which I do? So treatment is very, very simple, guys. You have to inflate the alveoli. So uske liye the air which you are sending inside should be a positive pressure or a negative pressure. Batao? Obviously the air which you are sending inside should be positive pressure. So what you do is that you put a mask and send positive pressure. Now you have to send the positive pressure continuously or you will take a break in between. No, you have to send the positive pressure continuously. That is why it is called as continuous positive airway pressure or CPAP. Okay, so you do a nasal CPAP. Along with that, you put a peep of about 3 to 8 centimeters of water. Okay, 3 to 8 centimeters of water. अभी ये peep क्या है? Peep मतलब positive end expiratory pressure. Now all of you might think that when I'm taking air inside, my lungs are expanding, so my alveoli also will stretch out, so more oxygen is taken inside. Now when I'm exhaling, you might think that my lungs are constricting, so my alveoli also will collapse. No. Even you are exhaling also, there is some amount of air which is kept in the alveoli to keep the alveoli continuously open like this. Okay? If this air is not there, then the alveoli will collapse. So this air, whatever is there here, to maintain this air, what pressure I will send inside, that pressure which I am sending inside is, this is positive end expiratory pressure. Okay? At the end of expiration, I have to maintain some pressure within the alveoli to prevent the collapsing. So uske liye ye मैं pressure maintain कर रहा हूँ. This is around 3 to 8. Now remember one thing, don't increase the PEEP for more than 10, more than 12 like that. If you increase, what will happen? ये alveoli के अंदर air ज़्यादा हो जाएगा and alveoli will burst out. Okay. So nasal CPAP with PEEP of 3 to 8 centimeters of water. After this, what will I do? Still, if there is respiratory insufficiency, still if the symptoms are there, still if the saturations are not normal, right? If respiratory insufficiency is there, still if there is respiratory insufficiency, the second thing what I do is that I remove the mask and everything, simply I put a tube into the trachea, that is called as intubation. Okay, so I intubate the baby. After intubation, I'll send the air by mechanical ventilation. Mechanical ventilation. I send the air by mechanical ventilation. Okay? How much amount of air will you send inside? The target oxygen which you should keep is 90%, not 100%. Okay? Never ever send 100% oxygen into the baby, right? Into the neonate. Why? Because if you are sending 100% oxygen, this is a toxic. 100% oxygen is toxic. This would lead to retinopathy. Okay? what will it lead to? Retinopathy of prematurity. इसीलिए हम 100% ऑक्सीजन नहीं भेजते, only we send 90% oxygen. So the target oxygen which you should keep is, target oxygen should be 90% only. ठीक है? Why? Because 100% oxygen जो है, 100% oxygen is toxic for neonates. It is toxic for neonates. Toxicity matlab what toxicity? Retinopathy of prematurity. It would lead to retinopathy of prematurity. So I hope all of you understood this. Okay? So this is the first important thing. What we do is ventilation. ये पूरा ventilation है. Okay? All this is ventilation. Now, after this ventilation, the second important thing we do is that we try to synthesize that surfactant. ठीक है? Surfactant को synthesize करने के लिए what you need to do? Cortisol, that is the steroids. So what we do is that we give an IM shot of betamethasone. Betamethasone. We give an IM shot of betamethasone. Okay? So when do you give this? You give this for about 48 hours. Okay? What do you do? What do you do is that either you can give in 24 hours time frame, or you can give in 12, 12, 12, 12, right? 4 12, so 4 doses, or 24, 24, 2 doses. So in that time frame, you can give this. Okay? So this is all which you need to know regarding the important topic, that is respiratory distress syndrome. Right. I'm not from Kerala. Right. So this is all we discussed. I hope now you understood why surfactant deficiency would lead to this, why it is called as hyaline membrane disease, right? So any baby that is born between 20 to 36 weeks is called as a preterm. Guys, all of you understood this topic, whatever I've told you, right? Before we switch on to the next topic, that is cerebral palsy, all of you understood this? Yeah? So give me a green signal so that I'll start discussing the next topic now. Very good. Very good. Very good. Thank you so much. Thank you so much. All of you understood. I'm really happy that you understood. Right? Very good. Very good, Pilot Saini. Very good, Osama. Sajda, very good. Chalo. Now we shall discuss another important topic that is called as cerebral palsy. Now this topic is easy, but at the same time little bit tricky. I want you to pay full attention over here. Okay? Guys, now what I want you to do is that even if you're writing notes by now, okay, stop writing notes. Okay? This video will be uploaded, notes will be given, all of you know the same things. ये topic बहुत important है, right? I want you to focus fully on what are the things I'm discussing here. Okay? Chalo. Cerebral palsy, the name itself says, है ना? Cerebral palsy, all of you know what is cerebral palsy. Anything can it be. If there is insufficient amount of oxygen reaching to the baby, leading to hypoxic ischemic encephalopathy, है ना? This would lead to cerebral palsy. If there is any trauma for the head, that would lead to cerebral palsy. During the delivery, if there is any trauma, that would lead to cerebral palsy. Right? If there is decreased blood supply, that would lead to cerebral palsy. So there are different etiologies. We shall discuss one by one. Okay? So यहाँ पे actually बहुत सारे etiologies है, because this is a common topic, है ना? Coming to the etiology. In cerebral palsy, what is happening? There is stopping of brain. Okay? In simple language, stopping of brain. So that is what giving us a mnemonic today. Stop brain. What is stop brain? S here stands for agar, if there is any kind of structural abnormality of the brain, that would lead to cerebral palsy. S stands for structural abnormality. Okay? Structural abnormality of the brain. Second important thing, T. T stands for torch infections. All of you know torch infections are very, very, very important, right? So torch infections. T stands for torch infections. Torch infections के बाद O. O stands for oxygen deficiency. Oxygen deficiency मतलब क्या? That would lead to what? HIE, hypoxic ischemic encephalopathy. We discussed about it clearly in the previous videos, है ना? So O stands for oxygen deficiency or oxygen deficit. Okay, when oxygen deficit, at which period can it lead to cerebral palsy? Around the time of birth. Around the time of birth, matlab perinatal deficiency in oxygen is called asphyxia. So around the time of birth, if there is perinatal asphyxia, that would lead to cerebral palsy. So perinatal asphyxia, perinatal asphyxia, perinatal asphyxia. Okay. Hello Navnath, how are you? Next, after that, we have got P. P stands for preterm birth. Preterm birth is always a risk factor for almost all pathologies, guys. Okay. So this is all about stop. S-T-O-P. Stop. Okay. Now, after this stop, next we will discuss the second important thing. Second important thing is the fifth one. Birth. Stop. Brain. B stands for birth weight. B stands for birth weight. Right? I told you that the normal average weight of an Indian baby will be around 2.5 to 4 kgs. Okay. But standard value is 2.9 to 3.9 kgs. But average value of an Indian baby is 2.5 to 4 kgs. 2.5 is a niche, that is called low birth weight. Right? So the birth weight below 2500 grams is a low birth weight. So they are under a risk of developing cerebral palsy. Or sixth important thing R, है ना? R. What does R stands for? R stands for results of birth complications. Birth complications मतलब क्या हो सकता है, guys? Can I tell one complication of a birth? That is intracranial hemorrhage, right? So that is one. Because of that also there will be cerebral palsy. So R stands for results of birth complications. Results of birth complication मतलब intracranial hemorrhage. Intracranial hemorrhage. ठीक है? Next important thing. A. What does A stand for? Asphyxia. Again, for the mnemonic sake, I'm repeating the same thing again. Asphyxia मतलब वही perinatal asphyxia, not a new thing. ठीक है? Next important thing is I. What does I stands for? I stands for infections. Infections मतलब torch infections नहीं. Infections मतलब infections which are developing after the birth, postnatally. Postnatally क्या infections हो सकता है? There can be meningitis, there can be encephalitis, right? So I stands for infections. I stands for infections. Infections मतलब there can be meningitis or there can be encephalitis. Meningitis or encephalitis. Very good, fun mode. He's telling CNS infections, you are right. And finally, N stands for neonatal seizures. Neonatal seizures, right? So neonatal seizures. So these are all the important etiologies of cerebral palsy, guys. Abhi is etiologies mein I will tell you what are the etiologies you have to remember for your exams, hai na? So in the exams, torch infections, this is one very important etiology. Perinatal asphyxia बहुत important etiology है. Preterm birth is one more important etiology, and finally intracranial hemorrhage. These four etiologies you have to remember it. ठीक है? ये चार जो है ना, they are very very important. Now let us enter into the topic. Okay? ये देखो. Cerebral palsy is divided into two types, classified into two types. एक है spastic, एक है non-spastic. मैं बताऊंगा what is spastic, what is non-spastic. Just for few minutes, bear me. One is called as spastic cerebral palsy, another one is called as non-spastic palsy. Okay? Spastic palsy में क्या होगा? What will happen is that there is damage to cerebral cortex. Okay? When there is a damage to cerebral cortex, from the cerebral cortex, what are the tracts that are coming down? Pyramidal ki extrapyramidal? Pyramidal tracts. So if I tell spastic paralysis or spastic palsy, where damage to the cerebral cortex is there is also damage to pyramidal tracts. So agar pyramidal tracts damage hua, then patient will have symptoms of pyramidal tract lesions. All of you know that, right? Now leave this thing. Coming to non-spastic. Non-spastic matlab damage to structures like basal ganglia and cerebellum. ठीक है? और through basal ganglia and cerebellum, what are the tracts that are running? Pyramidal or extrapyramidal? Extrapyramidal tracts. So non-spastic में you will have damage to basal ganglia and cerebellum, thereby leading to the damage of extrapyramidal tracts. So extrapyramidal tract lesions होगा, right? So now we shall write down the things which I have told you. Clear? So what I have told you is that cerebral palsy is basically divided into two important things. One is called as spastic cerebral palsy, ठीक है, और दूसरा है नॉन spastic cerebral palsy. One is called as spastic cerebral palsy, another one is called as non-spastic cerebral palsy. In spastic cerebral palsy, there is damage to cortex or basal ganglia cerebellum, damage to the cortex. There is damage to the cortex. Damage to cortex matlab which tracts are involved here? Pyramidal ke extra pyramidal? Pyramidal tracts. Pyramidal tracts. Thank you so much, Rishabh. Thank you so much. So next important thing, non-spastic. Non-spastic मतलब क्या है? यहाँ पे damage to structures. कौन सा structures है? I told you two structures, basal ganglia and cerebellum. Basal ganglia and cerebellum. Basal ganglia and cerebellum. अगर ये दोनों damage हुआ, then there will be a damage of what structures? Actually, what tracts are passing here? Extra pyramidal tracts. Extra pyramidal tracts. ठीक है? Now what we discuss is that first we'll discuss about non-spastic, उसके बाद we will discuss about spastic. ठीक है? अभी non-spastic में we will divide into two. अगर basal ganglia damage हुआ, if there is a damage of basal ganglia, what will be the problems? If there is a damage of cerebellum, what will be the problems? ठीक है? So what we shall do is that we shall divide it into two. If there is a damage to basal ganglia, what will be the problems? If there is damage to cerebellum, what will be the problems? Okay. Now what I want you to do is that all of you just look at the picture which I'm drawing on the board. Okay. Now all of you look here. For example, let us say this is your cerebral cortex, right? Now within this cerebral cortex, all of you know that ये center में जो point है ना, red color thing, whatever I'm drawing, this is called as thalamus. What is this called? Thalamus, right? Thalamus के नीचे जो भी nuclei है, they are called as subthalamic nuclei. Okay? ये देखो, this is called as subthalamic nuclei. What is this called? Subthalamic nuclei. Okay? After subthalamic nuclei, above this here we have got two important structures here, pink color, right? What are these pink structures called as? These pink structures are called as caudate nucleus. This is called as caudate nucleus. Okay. Second important thing is that here you have got these green color structures. These green color structures are called as internal capsule. Okay. We are not talking about that now. Now just side to internal capsule, here you have got another structure like this. Right? This is all from your basic anatomy, guys. This is called as your globus pallidus. Globus pallidus. And final important thing, these red color structures ये जो देख रहे हो ना, this is called as your putamen. Putamen. Okay. Now these are some of the structures of your basal ganglia. Right? I hope till here you understood. These are some of the structures of basal ganglia. Now what will happen when there is a damage to this? For example, agar if there is a damage of caudate nucleus, okay, if there is a damage of caudate nucleus, this would lead to a condition called, C for caudate nucleus, C for chorea. Okay, this would lead to a condition called as chorea. What is chorea? I will tell you in a minute. Okay. Next, agar if there is a damage of globus pallidus, this would lead to a condition called as ethetosis. Okay, this would lead to a condition called ethetosis. Ethetosis. So second important thing is ethetosis. Pehla wala chorea. And next important thing is if there is a damage to subthalamic nuclei, this would lead to a condition called as hemibellismus. Hemibellismus. Okay. So can I tell like this that if the patient is having non-spastic palsy, matlab basal ganglia structures are damaged, this would lead to two important or rather three important conditions. One is called chorea, one is called as ethetosis, right? And there will also be some conditions like hemibellismus, right? So what is this chorea? What is this chorea? What is this chorea is that you see these are the distal limbs, right? So there is rapid movement of distal limbs. So patient will have rapid movement of distal limbs like this. So this is what is called as your chorea. So this is what is called as your chorea. Okay, this is chorea. So what is this? Rapid. Is he doing voluntarily? No, involuntarily. So rapid. Yes, very good. Varun Kashyap told it is jerky rapid. Very good. Jerky rapid. Rapid movements of distal limbs. This is what is called as your chorea. Next important thing is ethiotosis or ethitosis. Okay. So ye kya hota hai? What is this? Is that the distal limbs, there are slow breathing movements. So this is the movement like this. Okay. These are called as slow breathing movements which you see in the patient. Okay. This is called as your ethitosis. Okay. So the distal limbs, you will see a slower breathing movements. Okay. Slower breathing movements. Slower breathing movements of kya? Distal limbs. Okay. Sometimes pata, you can see these two symptoms together. This is called as chorioethitosis. Chorioethitosis matlab you will see symptoms of chorea and you will also see symptoms of ethitosis also in non-spastic cerebral palsy. Okay. So we discussed about basal ganglia. What will happen if there is damage to the cerebellum? If there is damage to the cerebellum, the main symptom you will see is ataxia. Okay. When there is damage to the cerebellum, the most important problem you see is ataxia. Ataxia matlab kya? Whatever voluntary movements he is doing, there is a lack of coordination. Lack of coordination matlab, for example, I will tell the patients, right, to flip flop his hands like this. So in this way, right, alternately. So in this way, if I tell the patient to do, normally a patient with a normal cerebellar functions, normal extrapyramidal tract functions, they will be able to do it. But if a patient is having any kind of cerebellar lesion, so he will be doing like this. You see, there is no coordination between this voluntary movement and this voluntary movement. So this is called as lack of coordination movement. And by the way, this thing which I have told you to do, this is called as adiadochokinesia. Okay, right. So here you would see lack of coordination of the voluntary movements. Coordination of the voluntary movements. So in this patient, obviously, patient will have a lack of balance. Balance bhi nahi hoga, lack of balance and coordination. Right? Thank you so much, Kazmi. Thank you so much. And second important thing is intentional tremors. Intentional tremors. Intentional tremors matlab kya? See, in Parkinsonism you see resting tremors. अब यहाँ पे intentional tremors. Intentional tremors मतलब क्या? For example, if I am a doctor, है ना? What I will do is that I will catch the pen cap. I will give this pen to the patient. I will tell the patient to put the pen back into this cap. Now the patient is putting the pen. अब ये देखो tremors नहीं है, यहाँ पे भी tremors नहीं है, यहाँ पे भी tremors. The moment the patient is coming towards the target, he starts shaking. Okay, he starts shaking and starts overshooting the target. This is what is called as intentional tremors. So you will also see intentional tremors. So these are all the symptoms which I was telling you regarding the non-spastic cerebral palsy. Okay? अब ये देखो, coming to spastic cerebral palsy. Now in spastic cerebral palsy, what are the very important symptoms which you will see? In case of spastic cerebral palsy. In case of spastic cerebral palsy, so simple way to remember this is, guys, think spasticity matlab the word itself is sounding like something tight, something stiff, है ना? Spasticity matlab something tightness or stiffness. And yes, यहाँ पे muscles ना बहुत tight हो जाते हैं, they become more tight and stiff. Okay, that is what is called as your spastic cerebral palsy or spastic paralysis. Okay, now in these patients everything will be increased. Everything matlab, for example, muscle tone. Muscle का tone क्या हो जाएगा? If muscle tone is less, obviously the limbs everything will be weak. अगर muscle tone ज़्यादा है, the limbs will be stiff like this. So spasticity में stiffness ही होगा. So in this the patient will have increased muscle tone. Not only that, अगर deep tendon reflexes देख लिया, right? the deep tendon reflexes also will be exaggerated. So deep tendon reflexes will be more. Now this patient, because of increased muscle tone, he will have a hypotonia or hypertonia. I mean, will he be rigid or flaccid? Obviously, he will be rigid. Rigid ka opposite is flaccid. Third important thing is that you would also see toe walking in a patient. Okay, you would also see toe walking or equinus deformity. Equinus deformity. Now, what is this toe walking or equinus deformity? Let me show it to you. Right, all of you look at this video. Now, in this video, can you look at the video, guys? Can you look at the video? Yeah, you can see here very clearly. Look at the child who is walking here. He is walking on his toes. Yeah, dekho. He is walking on his toes with his knees crossed. Okay, this is called as scissor gait. This is called as, ye dekho. He is walking on his toes and look at his knees. His knees are also crossed, right? So this kind of gait, whatever you see, this kind of gait is called as scissor gait. And this kind of walking you see is called as toe walking or equinus deformity. So fourth important thing what you see is scissor gait. Scissor gait. Okay. So fourth important thing what you see is scissor gait. So these are some of the important, and fifth important thing is you would also see primitive reflexes. Primitive reflexes matlab one of the reflexes Babinski sign, hai na? You will see a positive Babinski sign. Positive Babinski sign, right? So these are some of the very important spastic cerebral palsy symptoms, guys. Okay? These are some of the very important spastic cerebral palsy symptoms. And I have already told you non-spastic cerebral palsy symptoms bhi bola tha, hai na? One you called as chorea, another one called as ethiotosis. So sometimes there can be a combination of both of this, chorioethiotosis. Apart from that, you will also see ataxia. Okay. Now, after this, the next important thing we do is that once a patient, if I look at a patient having cerebral palsy, what are the diagnoses I will do, guys? So diagnosis matlab one important thing keep in mind, there is a problem with the brain. So any diagnosis I do, I have to check the brain. For checking the brain, the first important diagnosis I do is cranial ultrasound. Okay. So when I do cranial ultrasonography, I can find whether there are any hemorrhages or not. Okay. Uske baad मैं करूँगा MRI scan. So first diagnosis, whatever I do, right, that is cranial ultrasonography. So whenever I do cranial ultrasonography, I am going to see if the patient is having intracranial hemorrhage. Okay, intracranial hemorrhage or intracerebral hemorrhage. Right, intracerebral hemorrhage. Intracerebral hemorrhage, or if I will see if there are any hyper intense lesions, है ना? तो इसमें मुझे क्या दिखेगा? I can see whether the baby is having hypoxic ischemic encephalopathy or no, right? Now this I do by cranial ultrasonography. उसके बाद I will do MRI. Okay, when I do MRI, in MRI what I can see, you know, you have got ventricles, right? ये देखो, this is your brain cord. Let us say this is the MRI scan, और यहाँ पे you can see the ventricles like this, है ना? Surrounding the ventricles, whatever white matter you see, there is a damage to the white matter. So whatever this shading, whatever I'm doing, this is a damage to the white matter surrounding the ventricles. So how do you name it? Surrounding the ventricles matlab periventricular, है ना? Periventricular. Damage to the white matter. Damage is called malacia. White matter is leukomalacia. Periventricular leukomalacia. So periventricular leukomalacia, you will see damage to the white matter surrounding the ventricles. I'll show you a scan now. Just look at it. अब ये देखो, these are the ventricles. ये normal है, ठीक है? पहले ही बोल रहा हूँ, these are normal. And this is the first and the second ventricle. Surrounding the ventricle, can you see any white color, guys? Any damage to the white matter here? Can you see anything? Nothing like that, right? There is no hyper intensity lesion here. अभी ये देखो, look at the next one. You see, surrounding the ventricles, can you see a white color thing here? Right? High intensity. You can see an high intensity image over here. right? So this is called as periventricular leukomalacia. Abhi ye bhi dekho. Look at the next one. Here also you can see some hyper intensity structure, right? This is periventricular, again leukomalacia. Clear? All of you are clear with this? Right. So where do you do that? I do it on an MRI. On an MRI, I can find it out. So basically, do hi do hai. There are only two things. Either one is physical examination. Physical examination, matlab you do tests, है ना? If there is rigidity, cogwheel appearance, है ना? So all these things you see. Second important thing, diagnostic step is cranial ultrasonography to look out the cause of this cerebral palsy, and MRI also do for the cause. Okay, so once the diagnosis is confirmed, the second important step you do is you do the treatment. Okay, so what is the main treatment you do? Here the infant is having a rigid body, है ना? So muscles पूरा tight हो गया. Now you have to, or all the muscles are under a heavy spasm. You have to release this spasm. Muscles को relax करना चाहिए. तो क्या देना चाहिए? Antispasmodics. Antispasmodics. You give antispasmodics. ठीक है? One example of antispasmodics is botulinum toxin. All of you know. ये आजकल ना बोटॉक्स इंजेक्शंस भी आ रहे हैं, यू नो दैट, टू क्रिएट ए डिंपल हियर. So whatever it is, botulinum toxins are there. Now ये botulinum toxins, what they do is that these botulinum toxins, they inhibit some kind of proteins called as snare proteins. Okay, so those things I cannot go into detailed concept, you will study in physiology, don't worry about that. Okay, they damage the snare proteins. As a result क्या होगा? Acetylcholine release नहीं होगा. When acetylcholine is not released, so obviously there will be what do you see? There will be paralysis of the muscle. I mean, the muscle will get relaxed. Okay, so antispasmodics matlab the first important thing is botulinum toxin. Okay, botulinum toxin to relieve the muscle spasms, and you can also give BZP, benzodiazepines. Benzodiazepines. Okay. Now there is a problem with the brain. Agar problem with the brain hai, then don't you think there will be seizures, right? So you have to give anti-seizure medication, anti-convulsants. Okay. Third important thing is you should also give anticholinergics to support this treatment. Anticholinergics. Okay. So anticholinergics matlab what will you give? Why do you give anticholinergics? क्योंकि there is excess release of acetylcholine, that is what is relating to rigidity. So इस rigidity को कम करने के लिए, you give anticholinergics. And not only that, guys, in these patients, if you have seen or not, there will also be continuously the saliva drooling. Silaria will be there, continuous saliva drooling. For that also we give anticholinergics. Sialoria will be there. Okay, so these are Square Academy, when we practice on teaching and all, so automatically we remember. That is not a big matter. Okay, so but just we need to go through before we start the class, right? So all of you guys, all of you understood all the concepts which we discussed today. We discussed two important topics, right? And not only these, the previous classes also, have you understood? Yes or no? Everyone now? So later on, guys, we will have a session. Okay, we will have a clinical case discussion session where after every topic I'll be putting the questions. Okay, so we will discuss mainly the clinical questions, however they are asked in your exams, because just studying the topics are not enough, right? And at the same time, you might not remember all these things, and even after remembering all these things also, there might be some 2 or 3 small symptoms that might skip out of your mind, right? So when you're doing a clinical case MCQ, you might not get that point because that point has already gone out of your mind. You remember the topic, but small points, for example, dyspnea, orthopnea, platypnea, so these things you might not remember, right? So that is why we will discuss all those important things. I'll tell you how to even solve a clinical question. What is the method of solving a clinical question? So that session will be really interesting. So quick review on the last topic. So last topic, guys, I have discussed. वैसे बताओ last topic कौन सा है? Any idea? What was the last topic I have discussed? Hypoxic ischemic encephalopathy, right? No. Kalvala topic, Kalvala. Hypoxic ischemic encephalopathy or perinatal asphyxia, right? So this was a topic which I was discussed. There is nothing to remember. Just you need to remember the etiologies, Bhushan. Okay, risk factors and all. So all the notes, Bhushan, I hope you haven't got the notes. The notes are already in the Telegram group. Okay, so put the video fast forward, look at the notes very easily. You will understand. Believe me. Don't worry about that. There is nothing much complicated things in this topic. Okay, very easily you'll understand. Okay. So the overall concept of the last topic is what are the things that are leading to reduced blood supply to the fetus. Bus. So apart from the last topic, guys, Bhushan, you were there in the previous class. All of you understood, guys. All of you understood all the topics which we discussed today, right? You give a green signal, then I'll go. Let's put an end to this class. Very good. Very good, guys. Thank you so much for your support all the time, right? And I want you to revise. I'll send you the notes today itself, right? So you have Saturday and Sunday 2 days of holidays, then you can happily revise. Okay, so thank you so much and love all of you. Goodbye.